Good evening, students. Today we'll be discussing about the anterior triangle of neck. So to start with, we are seeing the diagram of anterior view of the neck. You can see this dark line represents the anterior border of sternocleidomastoid. So if you see in each half, you are seeing three and a half triangles. This is the half of the submental triangle. This is the digastric triangle, and this is the carotid triangle, and this is the muscular triangle. Let us see the boundaries of the anterior triangle. So as you see here, anterior triangle is bounded in front by the anterior midline of the neck from symphysis mentae to the suprasternal notch. So behind it is bounded by anterior border of the sternocleidomastoid muscle. Apex is below and is at suprasternal notch. Base is formed by lower border of mandible and a line extending from angle of mandible to the mastoid process. So roof is formed by following structures, namely the skin, superficial fascia, platysma, investing layer of deep cervical fascia. Roof is also traversed by cervical branch of facial nerve and ascending and descending cutaneous branches of the transverse cervical nerve. As you can see, these are the midline structures of neck. Let us just trace these structures extending from symphysis mentae above to the suprasternal notch below. As you start here, you can see this is the symphysis mentae, and in the midline you can see a median raphe extending from symphysis mentae to hyoid bone, which is formed by the decussation of fibers of the mylohyoid muscle, which forms the diaphragma oris. You can see this is the body of hyoid bone. So this is the thyroid ligament or thyroid membrane, and then you can see this is thyroid cartilage with the Adam's apple, and then you can see this is the cricoid cartilage. So this will be the median cricothyroid ligament, and then below that you can see the trachea. So in front of trachea you can also see the isthmus of the thyroid gland. So this point is very crucial because this site is a site for tracheostomy, where we do the endotracheal intubation in case of respiratory failure. And then you can see this is the suprasternal space of Burns, where you are seeing the jugular venous arch connecting the two anterior jugular veins. And this is the suprasternal notch. So these are the midline structures of the neck. So you can see in each half of anterior triangle, you are seeing a half of submental triangle, a complete digastric triangle, a complete carotid triangle, and a complete muscular triangle. So three and a half triangles are present in each half of the anterior side of the neck. So total 7 triangles are present in complete anterior area of the neck. Only the submental triangle is shared between the two sides. So let us go in detail about the different triangles of neck, starting with the submental triangle. You can see here the name itself speaks submental, below the mentum. So below the symphysis mentae. So apex, you can see this will be the apex, which is formed by the symphysis mentae, and this will be the base formed by the hyoid bone, and these are the two lateral boundaries formed by the anterior belly of digastric. And if you see, these are the contents, namely the submental lymph nodes and the beginning of the anterior jugular vein. So this is the floor formed by the two mylohyoid muscles forming the diaphragma oris. So let us see the same things like repeated. So this, you can find this as the notes, which will be helpful for you. Just try to make a notes when I am describing this, starting with the apex, which is formed by lower border of symphysis mentae, base by hyoid bone. On either side, anterior belly of digastric muscle, floor formed by the mylohyoid muscle. Then half of the submental triangle is present in each anterior triangle, and the contents will be submental lymph nodes and beginning of the anterior jugular vein. And now you are seeing the digastric triangle. The name itself speaks, it is between the two bellies of the digastric. That's why it got the name digastric triangle. And you can also see there are three muscles actually which are forming the floor of the digastric triangle. From anterior to posterior, you can see the mylohyoid, hyoglossus, and the middle constrictor. And you can also see the integral arrangement. Like if you go from anterior to posterior, the more posterior we go, the layers are becoming deeper. That means the mylohyoid is superficial to hyoglossus, and hyoglossus is superficial to middle constrictor. So one is overlapping the other. So now let us see the boundaries. Above, it is actually this corresponds with the base of the anterior triangle, as we already seen this. The above boundary is found by the lower border of mandible and a line extending from angle of mandible to the mastoid process. Below and behind it is the posterior belly of digastric and styloid muscle, and below and in front it is the anterior belly of digastric. Floor will be formed by the three muscles which I have described just now: mylohyoid, hyoglossus, and middle constrictor. The stylomandibular ligament divides this triangle into anterior and posterior parts. You can see here. So this is the main substance of the digastric triangle, where this part constitutes the anterior part where you are seeing the submandibular gland, submandibular lymph nodes, facial artery. You can also see a part of facial vein. You can see the hypoglossal nerve here, a part of hypoglossal nerve. And deep to this, there will be mylohyoid vessels and nerve. So behind you can also see the external carotid artery, and here there will be the apex of the parotid gland, and you can also see upper part of the carotid sheath containing the internal carotid artery, internal jugular vein, and the vagus nerve. So contents of digastric triangle: in the anterior part there will be superficial part of submandibular gland, submandibular lymph nodes, facial vein, facial artery, mylohyoid vessels and nerve. In the posterior part, there will be lower part of parotid gland, external carotid artery, carotid sheath, which has internal carotid artery, internal jugular vein, and vagus nerve on more posterior plane. So now coming to the carotid triangle, as you can see here. So this triangle is having the carotid arteries like common carotid, external carotid, internal carotid. So this triangle derives its name from its arteries. So you can see the boundaries. So this will be the posterior belly of digastric and stylohyoid will be there. And here you can see the superior belly of omohyoid, and this will be the anterior part of the sternocleidomastoid. And even in the floor you can see so many muscles here. So this will be the hyoglossus, this will be thyroid, this will be the middle constrictor, and this will be the inferior constrictor. So you can see here in front and above it is found by the posterior belly of digastric and stylohyoid muscles. In front and below it is the superior belly of omohyoid. Behind it is the anterior border of sternocleidomastoid, and floor will be found by 4 muscles, namely the thyroid, hyoglossus, middle constrictor, and inferior constrictor. So you can see the major contents of this. From the diagram itself we can derive so many contents, like we can see this is the common carotid artery. You can see the bifurcation of the common carotid artery into external carotid and internal carotid. You can also see a dilatation at the bifurcation of common carotid artery, which is called as carotid sinus, and the posterior wall of carotid sinus will have the carotid body. Carotid sinus will be a baroreceptor, whereas carotid body will be a chemoreceptor. Accordingly they will respond. And you can see few branches from the external carotid artery. This will be the superior thyroid, this is the ascending pharyngeal, and this is the lingual, and this will be the facial, and this will be the occipital. So then you can see here, this is the carotid sheath. Actually carotid sheath is removed here to expose the contents. Like you can see the internal carotid artery, you can see the internal jugular vein, and you can see the vagus nerve, and you can also see the spinal accessory nerve, and the glossopharyngeal nerve, and the hypoglossal nerve. As you can see, over the carotid sheath you can see a loop of nerve called as ansa cervicalis. So this will be described later. You can see the contents of carotid triangle. So if you take the names of the arteries, these are the following arteries which we can try to identify during dissection, namely the common carotid, internal carotid, external carotid, which is very easy to identify because they are large. But once we try to dissect out the branches, so we have to dissect out very narrow space to find these arteries like superior thyroid artery, lingual artery, facial, occipital, and ascending pharyngeal. So in dissection, we'll try our level best to see majority of these arteries. So then at the bifurcation of common carotid artery, as I said earlier, there will be a dilatation, a bulb-like dilatation that is called as carotid sinus. So it acts as a baroreceptor. So when this carotid sinus is irritated, it will result in slowing of heartbeat and syncope. So these kind of symptoms are called as carotid sinus syndrome. And this carotid sinus is innervated by glossopharyngeal nerve, vagus nerve, and sympathetic nerves. So in the posterior wall of the carotid sinus, there will be a carotid body, so which is formed by sheath cells, epithelial glomus cells, and fenestrated capillaries. It develops from third branchial arch mesoderm, and this acts as a chemoreceptor. It monitors oxygen tension. When it is stimulated, um, due to less oxygen, like anoxia, it results in rise in blood pressure and heart rate. So there will be a tumor of carotid body called as potato tumor. So it enlarges and compresses the carotid sinus, resulting in slow pulse and fainting. Then this is also supplied by glossopharyngeal, vagus, and sympathetic nerves. So the other contents will be internal jugular vein and its tributaries. The following tributaries can be seen in the carotid triangle, namely the lingual vein, superior thyroid vein, common facial vein, pharyngeal vein, and occipital vein. And nerves will be spinal part of accessory nerve, loop of the hypoglossal nerve. So this loop will give the following branches like descendants hypoglossal and nerve to thyroid, and vagus nerve and its branches. The named branches of vagus nerve which can be seen in carotid triangle are the pharyngeal, superior laryngeal nerve, then branch to carotid body and carotid sinus, and superior and inferior cervical cardiac branches. So other than that, we can see the apex of the parotid gland. So this is seen both in digastric as well as carotid triangle, and we can also see the deep cervical lymph nodes, namely the jugulo-digastric and jugulo-omohyoid group of nodes. So muscular triangle, you can see here this green color shaded area is the muscular triangle. So it is bounded anteriorly by the anterior median line extending from hyoid bone to the suprasternal notch, whereas behind and above it is omohyoid, superior belly of omohyoid, and behind and below it will be the anterior border of the lower part of the sternocleidomastoid muscle. So as such, significant contents are not present in this muscular triangle, but floor will be formed by two muscles, namely the sternohyoid and sternothyroid. So deep to this floor, there are important structures like thyroid gland, trachea, and esophagus. So this area is very important when we are dealing with the tracheostomy in ICUs and emergencies. You can see here. So this is the sternohyoid. So we can cut and reflect the sternohyoid. Then deep to that, we can see the sternothyroid. So now this is the ansa cervicalis, which is present in the anterior aspect of the carotid sheath or in front of the carotid sheath. So this is having two loops. The one loop is called as descendens hypoglossae, which comes from the hypoglossal nerve that is having the fibers from C1, whereas behind there is one more loop which is formed by C2 and C3 that is called as descendens cervicalis. So both of them joined by the ansa cervicalis. So in the next diagram we can see clearly the C1 fibers joins with the hypoglossal nerve for a short course, then again they are separated from the hypoglossal nerve as descendens hypoglossae. Then the inferior root of the ansa cervicalis is formed by C2 and C3, which is called as descendens cervicalis. Both of them will join by a loop called as ansa cervicalis. And you can see there are three branches which are coming from ansa cervicalis, which supply to sternothyroid, sternohyoid, and inferior belly of omohyoid. Whereas descendens hypoglossae supplies the superior belly of omohyoid. And the remaining C1 fibers travel forward and supplies the thyroid and genohyoid. Thank you.